Good morning. In 1995, for the first time, as you know, intravenous thrombolytic treatment was approved for treatment of patients with acute ischemic stroke if they presented before 3 hours from the stroke onset. And then it took us more than a decade to extend that time window to 4.5 hours in 2008. And then we went through this learning phase that we tried basically to learn imaging and devices, and we kind of stagnated. We had multiple failed clinical trials, in the search of new treatment for acute ischemic stroke patients. And finally, in 2015, multiple randomized clinical trials showed the effectiveness of thrombectomy and endovascular treatment for patients presenting less than 6 hours from the onset of stroke. And then a few years later, with the conclusion of late window trials that includes diffuse 3 and down, which we're going to talk about later in the talk, we extended that time window to up to 24 hours. So you can see that we have come a long way from 1995, and now basically we can treat patients up to 24 hours if they meet certain criteria. And we have to say that imaging has played a significant role in this evolution. We have to use proper imaging to identify large vessel occlusion. We have to evaluate the status of brain tissue to establish a relatively small infarction at the baseline and to demonstrate significant deficit that can be preserved. And that have moved us from the concept of time clock